everyone, it's Dr. Jen. Welcome back to a Q&A. We are doing these special in the Integrative Health group on Facebook. I'm going to ask people to put their questions and what they're struggling with, and we're going to answer them on the podcast and YouTube. If you would like to submit a question, you can submit it to Dr. Jen at phlegmed.com with the subject titled Dr. Jen Q&A. And as always, please like and subscribe. Share this if it helps you at all or you think it would help anyone, because I would like this informed consent goodness to get out there. I am a practicing physician and double board certified, so it's hard to get through some of the bad information out there. And as always, this is not medical advice. This is just suggestions, things that I've seen that have worked in my practice. So let's get started. Someone was asking weight loss / macro counting and dealing with Candida after overcoming H. pylori. Okay, so gut health is big with weight loss. We need to make sure that our gut is functioning properly, that our GLP-1 receptors are taken care of, that we have a good amount of good and bad bacteria, that they're in a good ratio, okay? So when we have a lot of good bacteria, then if we have some Candida or bad bacteria, it covers that, right? We're not going to see Candida rise up and cause problems. But what happens is there's a dysbiosis or overgrowth of the bad bacteria. And Candida is so common for women, so common in women in perimenopause, leads to sugar cravings, it leads to bloating, it leads to skin problems. It allows other infections to come in, such as H. pylori or C. difficile, causes inflammation, creates biofilms, right? Yikes. What are symptoms of Candida overgrowth? Symptoms of Candida overgrowth are sugar cravings, bloating, rashes, itching, yeast infections, rashes under the breast of Candida, brain fog can be big with that, fatigue, trouble sleeping. So a lot of different things can be out of whack. What I think is interesting is I think it's pretty common after being on birth control. So me personally, I was put on oral birth control to regulate my period when really it was Hashimoto's that was the problem. So this is also why if you're listening and your daughter or yourself, you're going through irregular, erratic periods or something isn't right, no matter what the age, that is a warning sign. Our cycle is like a vital sign for our health as women. And if it's off or you're having all these crazy symptoms, like PMS is not normal, even though it's normalized. So just because it's normalized doesn't mean it's normal. And this happens a lot in the health field. So what we can do is that we can really examine our cycle and figure out what's going on. Now, what you don't want to do is jump on birth control. So anyway, I was put on birth control to regulate my period. And we know that oral birth control contraceptives, it's conjugated equine estrogen. It's CEE. It's not real estradiol. It is not doing good things on those receptors. It's doing bad things. And it's also depleting us of minerals and also making it more likely for Candida to grow in the gut. So this happens a lot. And I remember personally, I didn't have any signs of yeast infections until after my doctor in high school put me on birth control. And I did not need to be on birth control. And then I struggled with Candida up until about, 10 years ago when I, really started practicing the integrative medicine in my practice over 10 years ago. But this Candida can flare up too in patients. So I see patients get it under control. I have a protocol on Healthy by Dr. Jen for Candida. It works excellent. Sometimes though, if botanicals don't help, we do go to things like diflucan, right? Or nystatin. Sometimes we do need that to break down the biofilm. So it really just depends on the patient. So when we're looking at coming out of a Candida infection, stress, you want to make sure that you're not stressed, that you are not creating stress, because when we have high stress, high cortisol, we're going to create an environment in our gut that it's going to be favorable for overgrowth of Candida and the bad guys, going off. So we want to make sure that. We want to make sure that we're replenishing with good probiotics, and spore-based probiotics too are helpful. And then that we're not killing off the good guys. So we're not swimming in glyphosate, right? If you live in the Midwest, that could be an ongoing problem that I tell my patients in the Midwest, you should probably be on gut protect powder every day, especially during harvest season, because otherwise you're getting inflammation in that gut. The good guys are getting cut off and not good. They're dying off. So you're going to get that dysbiosis. Antibiotics. So if you have to go on antibiotics for some reason, then you need to supplement with a probiotic and prebiotics to feed the good guys that are left. So we know that there's an increased risk of candidiasis or candida after antibiotics, oral or IV. So you got to realize that you have to be proactive. And when I work in the ER, I always prescribe a probiotic with the antibiotic, and I explain with them how to take it, 2 hours, 1 to 2 hours, 2 to be safe apart from your antibiotic, and take it for at least a month, but keep going. But I try to at least teach that little bit in the emergency room. And please don't give antibiotics for viruses. Don't take antibiotics for viruses. Sometimes doctors or practitioners, especially if they're new practitioners in the urgent care and they're just out of school because they just want to, get a job, and they hire new grads because it's less expensive. It's awful, I know, but they will just give antibiotics, even though it's a virus, because it takes longer to educate the patients. You have to advocate for that. And I think antibiotics have such an important role in diseases, but keep a healthy gut first, because we know that our immune system is in our gut. So you're coming off killing the candida, your sugar cravings are better, your sugar cravings start coming back. Well, is it stress, right? Is it just you need to do a sugar reset? Try to decipher that. But I will say that, sugar is addictive. So you have to be careful that you're not feeding that addiction. And then if you're feeding that addiction too, you're feeding the candida in the gut. And then if the candida in the gut are overgrowing, they are going to, through the gut mind connection, ask for sugar, right? So we have to be careful. It's a vicious cycle, I know, but it's something that you can get under control. So I recommend like a 3-day sugar fast if you're trying to like kick the cravings. And a lot of the times, like a carnivore diet short term can really shut down those sugar cravings. Even a 3-day sardine fast or a 3-day carnivore bar fast will just reset it. I know over Christmas, I felt like I was getting out of control. I'm like, oh my goodness, I'm just losing it. I'm so inflamed. I just I'm craving sugar and I'm just eating it. And I was stressed too because we were moving. And I just was like, no. And I did probably 3-day animal based, but like a full 2 days of just carnivore, and just reset everything to whole food. But this could include fruits too. So sometimes you just need to shut that down, or just have berries, which are lower glycemic index. So all of these things could be helpful if you're coming off a candida infection, or if you're coming off like sugar cravings. And all these things that I'm telling you guys about, they're all going to help with weight loss too. Isn't that amazing? And inflammation. So one of those resets can be very helpful. Okay. And you're just going to feel better. Your skin's going to look better. You're not going to be as bloated. The inflammation's going to be better, because candida is always going to be there in the gut. And it's okay to have some candida in the gut, but it's when it overgrows that it's the problem. Okay. It's when it overgrows and creates inflammation, and you are just having leaky gut or dysbiosis from all the inflammation from the candida. So going off of the candida, once again, you just have to look out for those symptoms that it might be coming back, because it definitely could come back, because how did it get there in the first place? So if you're not changing that, then it could come back. So candida is one of those that you kind of have to keep in check. This is where I love gut protect powder. You could do colostrum along with that, making sure that you are keeping that inflammation low in the gut. You could use peptides such as BPC 157, KPV, and or lorazepatide to knock that inflammation down and keep that gut healthy, keep the villi nice and flourishing like they should be, instead of flat and not good. So all of those things are great. And like I said, you could find the protocol on Healthy by Dr. Jen. Let's do one more question. So they are having significant anxiety since the death of the mom a little more than a year ago. So, oh, I'm so sorry for your loss. That is heartbreaking. And anxiety, fear. So losing someone first, going to the church and asking for prayer, asking to be surrounded by the word, getting in the Bible and making sure you're asking God for help. The spirit of fear can be terrifying. And we know fear is how we're controlled, right? Fear is what the news does for us. Fear is what it can really cause significant problems. And it could also hurt our faith, right? So we need to really dig into what is going on with this anxiety. Like, once again, what is the root cause of the anxiety? Anxiety can also be caused by abnormal gut flora. And you'd want to look, what's going on with the gut flora. There's a lot of great botanicals for anxiety. You could be missing cofactors such as magnesium is great. So magnesium L-theanate is great at night. So I do have that at the store, 2 capsules at bedtime. It crosses the blood-brain barrier. Really great stuff. And then also Trimag. So I take both of those at night, and Trimag has the malate and bisglycinate and the citrate. So you need to replenish your magnesium, especially in times of stress. You're burning through a little bit extra. I love DHHB. It's from magnolia bark, and it is found in the product called Serenity. That one is great, also helpful for sleep too. So I love that one for anxiety. L-theanine is amazing. L-theanine is an amino acid found in green tea, which balances caffeine, balances the caffeine in green tea. And you can take that one. So it's just amino acid found naturally. So I tell patients they can take that if they're waking up in the middle of the night feeling anxious. It can kind of help them go back to sleep. You can take it during the day. A lot of women, when I check their saliva cortisol test, they have this spike in the afternoon. And it's because that is when, like, the kids are coming home from school, or if you're homeschooling, you're getting dinner ready and your husband's coming home. And it's like, you got to clean up the house from the kids being there all the day and like all the things, right? And I feel this sometimes, like when I would come home from work and then everyone was coming home and I was trying to cook dinner and everyone is just like, wants me and attention from me. So I sometimes will take an L-theanine in the afternoon. So that one is really helpful for anxiety. And that, along with the DHHB, I've had patients like really do well with it. And one of them, like, they were coming off some benzodiazepines with the DHHB. So that was great. Anxiety could also, a root cause, be from hormones. So if you are stressed, that is going to affect your progesterone and your hormone cascade. So maybe you are already perimenopausal, or maybe you're menopausal and not on hormones, and that anxiety can really creep up. So anxiety can 100% be from hormones. And that one is, you talk with your doctor, you test, don't guess hormones, and you appropriately treat depending on if you're in perimenopause, menopause, or you're menstruating, normally, but maybe your progesterone's a little low. So a lot to do with that. And it's, oh gosh, like when women have anxiety and perimenopause, and then we put them on progesterone and fix that root cause, it is like night and day. They do so well. It's great. I think it's amazing to see. And then we use oral progesterone if there's also trouble sleeping at night because of progesterone breaks down when you take it orally. It can be really helpful. One more thing I wanted to mention for anxiety that could be a root cause could be blood sugar balance and blood sugar problems. When we're on a blood sugar roller coaster, so say you're having something with higher carbs, it's shooting you up and then you're bottoming out, you could feel jittery, you could feel anxious. And I've had a few patients now that their anxiety was due to blood sugar imbalance and some insulin resistance. So that's something that you'd want to, you could wear a continuous glucose monitor. You could play around with different supplements. You could hunker down on your macros and check those out. But that's another root cause for anxiety that you definitely want to look into and make sure it's balanced. And balancing your blood sugar is just, it's key. It's key for longevity. It's key for going through perimenopause and menopause. It's key for being an appropriate healthy weight. Blood sugar balance is all of that. So that's another thing if you're having some more anxiety or anxiety creep up. Okay, that was 2 questions for the week. So I hope that this was helpful. I would love if you guys rated this podcast and gave a thumbs up on YouTube and show me that you guys like these breakout sessions, these Q&As, and I will continue to do them. So have a wonderful day.